Good afternoon. Thank you for joining us today. I'm Jennifer Bender, Public Information Officer with the Watertown Area Task Force. Today we have up first a community update from Mayor Sarah Karen.
Good afternoon. Today is April 27, 2020. In our state of South Dakota, we have a total of 2,245 cases now and 11 deaths. In Cottington County, we're still at 14 cases and 13 are recovered. Tonight there will be a special city council meeting at 5:30 p.m. You can call into this meeting if you'd like to express your opinion. Basically, the city council will be looking at the special emergency ordinance that it passed, which expires tonight at midnight. So the council has three options with that ordinance. One, they can let it expire, in which case we'll fall back on the governor's executive order for our requirements. Two, extend the ordinance for a longer period of time. Or three, modify the ordinance in some way to either tighten or loosen the restrictions. We also have our special emergency resolution on the agenda tonight for consideration as well, but that hasn't been very controversial. The ordinance, however, has been very controversial. The community is split on this issue. We've been requesting input and we've gotten quite a bit, and there are people passionately urging the council to open things back up, and many people passionately urging the council to keep the restrictions in place. So it should be an interesting meeting. The council has a difficult decision, and whatever they do, I want to assure you that it's being done with a great deal of thought. And something that is weighing on the council's minds is that we expect the governor to have a new executive order this week, maybe even tomorrow. And we don't know what that's going to say. So there's already so much confusion about what the requirements are or aren't. And I mean, we have requirements, the governor has requirements for our state. The President of the United States has issued some comments. So I would like to say a few words just to clear up some of the confusion. The ordinance that the city has is not a stay-at-home ordinance. And there are some businesses that are closed and some of them are restricted, but it is definitely not a stay-at-home ordinance. Closed are on-site food and beverage, but those food businesses can do carry-out and delivery. Closed are gyms, bowling alley, arcades, music and entertainment venues, and the theater. Not closed are churches, retail stores, and salons. And there's been so much confusion about that. Casinos are attached to liquor licenses, so it's really the liquor part of it which closes them. Casinos are not specifically called out in the special ordinance. So whatever the decision is made, I can guarantee you it's made with the best interest of the community in mind. I'd also like to talk about the cancellation of the fireworks event at the Redlands Center, which was planned for July 3rd. That has been canceled, and I made that announcement on Friday, and I want to assure you that that was not a unilateral decision that I made on my own. There was a great deal of consideration. I consulted with the City Council, I consulted with the Planning Committee, and I consulted with the Unified Command Team, and it was with a very heavy heart that we canceled that event. And primarily it was canceled because one, most of the activities occur on private property, and the property owner was uncomfortable with inviting thousands and thousands of people to gather on that land. And two, that is financed by donations, and every year about this time the mayor is sending letters out requesting people to make donations to fund it. And I do not feel comfortable sending letters out to businesses which are laying people off possibly. And, I don't know what people's financial situation is. So because of the fact that we have vendors and we have entertainers and we have supplies and equipment that need to be ordered months in advance, and we know we can't do the same thing that we've done in the past, and we decided that it was best to just cancel it. But that doesn't mean we will do nothing to celebrate Independence Day. We can still do a fireworks event if the community desires it. However, I don't think it's appropriate to pay for that with our dwindling sales tax revenues. So it's not something that I'll be asking the city council to fund. If there are private individuals or companies which want to donate toward an event to celebrate with fireworks on the 4th of July or the 3rd, please let me know. And I think that would be great if we could do something. The parade is not canceled at this time. If it becomes necessary to cancel the parade, that's something that we can do in very short order. There's not a great deal of planning that's required in advance for that. So at this time, we're still planning to go forward with it. I guess the bottom line is we need to come up with new ways of doing things. The fireworks event that we've enjoyed in the last few years has been fantastic, and I don't want people to think that what we're doing this year is a dud compared to that. That's canceled. We can't do that. We can do something different, though. Let's concentrate on what we can do, and we'll help get something together. One thing I want to stress, and we've been saying this over and over again, but it's really true. Personal responsibility is the key to getting through this virus with as little negative impact as possible. If we follow the CDC recommendations for social distance and personal hygiene and disinfection, we're going to be just fine. And we've actually been doing a really good job of that. Most people are doing a fantastic job of that. Every day that goes by, the picture is looking brighter and brighter. But we're also starting to see now that people are struggling with the effort, mostly from the social distancing. They're getting short with one another. We're seeing some disagreements. Whereas the folks were pretty on the same page when we started out, people are starting to migrate to the polls and opposite opinions and lashing out at one another, and this is not good. We need to all try to be just as patient and forgiving with one another as we possibly can. And we can also be very creative in the ways that we communicate with one another and visit. And there's a lot of things we can do, and let's concentrate on that. And we have been doing lots of really fantastic, fun, and creative things to keep people's spirits up. Let's keep doing that. And with that, I will let Steve talk about some other things. Thank you.
Thank you, Mayor. I'm Steve Rehorst, the Public Information Officer with the Watertown Area COVID Task Force. Myself and Jennifer Bender, who's also a Public Information Officer, we're going to give out a few resources just to remind people what's out there and also some updates. So first off, I have an update on the masks, the homemade masks that we've asked people to make. We're still in need of those, and if you're looking to do those, they're for the medical personnel or people on the front lines, and they can be a cotton or cotton blend material. They can be made from with either an elastic back or a tie back made out of the cotton material in the back there. They can be dropped off at the Salvation Army Monday through Friday from 9 a.m. to 5 p.m. And if you're looking to get the pattern, you can go onto prairielakes.com/mask pattern. We are going to take a look at our inventory this Friday and see where we're at and what our resources are and what we need to still produce to get out to those on the front lines in the medical community. So if you're still making those homemade masks, get them out to the Salvation Army, drop them off there Monday through Friday, 9 a.m. to 5 p.m. The other thing we're still doing, I want to give a huge thank you to everyone on Friday that came out to the food drive that was done and helped us support the food distribution project that is undertaken by the Salvation Army and the Watertown Community Cares Group. That is still going on. They are going to do that again this Thursday, and we put more information on that on our Facebook page as well, and we'll put some in the comment section as well. Two things that are coming up here. I talked to the Watertown landfill, and it is springtime out there. It's here. It's a beautiful day out, and then we start thinking about our Watertown hazardous materials turn-in event that we have. That event has been postponed. It's not canceled, but it's postponed. There has not been a new date set, and that event is typically something that happens at wastewater where people can turn in batteries and light bulbs and paint and aerosol cans and things of that nature. That event has been postponed, so be looking for an update when they come up with a new date for that. And then the other event that we all know happens every spring is the spring cleanup garbage drop-off week, where you put things on the curb to be picked up by the landfill. That event has also been postponed, and we're waiting to hear a date on that, when that will be rescheduled. So those two events, the household hazardous waste and the spring cleanup curbside pickup, those two events have been postponed, and we're looking to reschedule those dates. However, the Watertown landfill is open Monday through Saturday, and that is from 8 a.m. until 4 p.m. each day. And you can drop off if you're a Watertown resident. It's free to dump there. You just have to bring a current utility bill that shows that you do get garbage service. So that is still free at the landfill, and they are open. You just cannot go into the public building there. So the other, two things I'd like to mention from our volunteer section. One is the COVID helpers. And we had mentioned that last week. We talked about that. But what we want to do is we want to ensure that everyone out there that needs essential services or goods, those that are at high risk, are able to get those items. So if you're over the age of 65 or you have a chronic health condition, what I'd look you to do is call 237-7234. And what that will do, they're called the COVID helpers. They're going to help pick up items for you from the store or over-the-counter medications and then deliver them to you at your house. So you would call the store or the pharmacy and place your order, pay for it, and then someone would go and pick up those items and bring them to you. So if you're interested in that, or you know someone who's at risk, again, over the age of 65 or has a chronic health condition, call 237-7234, and they can get you set up there and see what resources they can provide to you. The other item is the COVID hotline. There's a lot of people out there that maybe have questions about COVID and medical questions. We want to kind of relieve some of the stress that the medical community may feel with people calling in and asking questions. So we have trained medical professionals that are volunteering their time on this hotline to answer questions. And so if you call in, you're going to want to call 753-1408. That's 753-1408. Maybe you have a question. Should I call my provider? Should I get tested for COVID? Should I self-quarantine? What should I do? You have some questions like that, go ahead, call that number, and that's going to be Monday through Friday from 9 a.m. to 9 p.m. and Saturday from 8 a.m. to 1 p.m. and then Sunday from 1 p.m. to 5 p.m. So go ahead if you have a question about COVID and you want to get an answer. It's kind of nice to have a place you can go to get that answer where you know there's someone that's going to have valid information for you. So that's why our volunteer branch created that group. So go ahead and call 753-1408 if you have any questions. With that ends my updates here. I'm going to turn it over to Jennifer Bender now with a few more updates. Thank you.
Thanks, Steve. So Steve just mentioned a wide variety of great resources, and I'm going to mention a few more. And before I do, I'm just going to give a plug to a great resource all residents in Cottington County have, and that is 211. So if you are looking for assistance and you can't remember all these phone numbers or how to get connected with different people, all you have to do is call 211, and those staff are trained to help you find the assistance you need and connect you to those facilities, organizations, or services appropriately. So they are also trained in crisis support. And so during this time, a lot of us may need those services, or if you're not in a crisis, maybe you're having a lot of anxiety, you need some support more just through an appointment, maybe you have some substance use concerns, Human Service Agency does have availability for appointments. And those appointments are available through telehealth technology, so video appointments or phone calls, that sort of thing. You can call 886-0123 for the Human Service Agency. So please don't wait if you have any questions or concerns about your mental or physical health. A lot of our clinics in town also have telehealth availability, so again, video or phone appointments. That's Garcia Family Clinic, Brown Clinic, Sanford Clinic, and Quick Care. So you can contact any of those clinics and they can talk to you about your concerns, set up a video appointment through those telehealth solutions. So it's really important to not put off your health, especially during this time. Another great resource that is available in our community is through the Boys and Girls Club. They have a virtual homework program that is available online, and it is available 3:30 to 5:30 p.m. every day, or not every day, every Monday through Thursday. So if you want to learn more about that, you can check out the Boys and Girls Club Facebook page for more information. Finally, covid.sd.gov is the South Dakota State's website for everything on COVID. So you can go to covid.sd.gov for things on small business loans, Governor Noem's Small Business Relief Fund, labor information such as unemployment claims. You can find a COVID-19 symptom checker there, and even links to resources like absentee voter instructions. So that's covid.sd.gov. Thank you for joining us today. Are there any questions from the media?
A question for Mayor Karen.
Yes,
A question for Mayor Karen, if she's available.
I'm right here. Go
Thanks,
right ahead.
Mayor. The governor had her daily briefing here at 3 o'clock, and she announced that tomorrow she's going to be rolling out the details of what she's calling her back to normal plan. And she said that if people are still uncomfortable with going out when things begin to reopen, they obviously have the option of staying home. Do you have any thoughts on that?
Well, I would agree with that. I think that some people, though, are concerned about their jobs, and not everybody can just stay home if they need to work. So that doesn't adequately answer that question. But I think that most of the businesses in town are doing whatever they can to make their workplace safe. And I think that if an employee has a concern about that they should definitely bring it up with the HR department and try to make improvements. It doesn't do an organization any good to have sick workers. Nobody wants that. So I'm looking forward to the end of this as much as anyone else, but we certainly don't want to pitch ourselves into any kind of a emergency. So we'll be very interested in what the governor has to say.
Quick follow-up, Mayor, too, if I could. It's my understanding that a pretty good-sized number of businesses in Watertown that have been closed for the past month or so essentially signed a petition and sent it to council members urging them to begin the process of reopening. Does that carry any weight? Do you think it might influence the decision that's made at the council meeting tonight?
Oh, I do think it carries some weight. The council wants to hear what the public wants to have done. And I think that I saw that, and I think there's some confusion about what the council has control over, because we really didn't close that many businesses with our ordinance. The restaurants were limited, but they weren't closed. Bars were closed. Gyms were closed. Entertainment places like for music and theater were closed, but retail stores and churches, those are all open, and no one has been ordered to stay home. So if we do let our ordinance expire, a lot of the controls will still be in place. And some of that's the governor telling people not to make unnecessary trips. Don't go to the store 3 times a week if you can avoid it. And, just try to be socially distant from people. And if we do those common sense practices, we'll be fine.
Mike Tanner.
Thank you.
Are there any more questions? Okay, if you would like to watch the City Council meeting tonight, you can tune in at 5:30 at GovTV or on the website, the city's website, as well to watch the City Council meeting tonight. Thank you for joining us today. We will be back tomorrow at 3 o'clock with another community briefing unless the governor's briefing